Our lecture today is again about friction, resistance to sliding, and force delivery system. So, for when we're slide the teeth, as we can see in this photograph, now we are using this tab to distalize the buccal segment. The force that is needed for two purposes mainly. The first purpose is to overcome the resistance that is created between the contact of the wire and the bracket. So we need to overcome this resistance, and then we need to create the bone remodeling that is needed for the tooth movement. So the force that we need to achieve this tooth movement has to overcome the resistance between the bracket and the wire, and has to be enough to create the remodeling of the bone that we need to achieve this tooth movement. For this lecture now, we're going to focus about this part, which is to overcome the resistance that is created between the contact of the wire and the bracket, or what we call it, resistance of sliding. Now, resistance of sliding depends on three factors. The first one is friction, the second one is binding, and the third one is notching. So friction between the surface of the wire and the surface of the bracket, as we can see here. And then binding is when this bracket binds to the wire, and we're going to explain all of these items later, and notching as well. So we will start with the friction as a resistance of sliding. So when two objects move relative to each other, friction at their interface produce resistance for the direction of the tooth movement. So if you look at this ball sliding on this surface, now friction will be in the opposite direction, trying to slow this ball down until it stops. If we don't have friction, if you slide a ball on the floor, it will slide for indefinite. But because we have friction, that friction will slow this sliding ball. Now the friction is proportionate to the force with which the two objects are pressed against each other. And we're going to talk about this later to explain it more. And also friction is affected by the surface interface, the nature of the surface, which means if it's rough or smooth. For example, if you're going to slide the same ball here on a carpet, it will slide slower than if you slide it on a ceramic ground or ceramic floor, for example. So the nature of the surfaces that sliding happen on will affect the friction. And also not the roughness and the smoothness, also the chemical reactivity, whether it's passive or active. And we will see later on how that the chemical composition of the material can also affect friction. And the last thing is friction also can be modified by lubricant. Now in the oral cavity, for example, we have saliva. So to summarize it up, friction, it will be the resistance for the direction of the movement that we are having this one. Now this friction, it will be affected by the contact by which the two surfaces pressed against each other. We're going to discuss this later. And also it depends, or it will be affected by the nature of the surface interface itself, roughness, smoothness, chemical activity, and whether we have lubricant or not. Now we have two types of friction. The first one is called the static friction, which represents the smallest amount of force needed to commence the process of sliding on an object. So the object will be sliding in a smaller amount, not a big sliding. And the other one is called kinetic friction, which represents the amount of the force resisting the motion during motion. And usually it's the product of the normal force and the coefficient of kinetic friction. So basically, static friction represented a smaller amount of movement, tipping and brightening, while the kinetic one, you're resisting the amount of the force that resisting the motion during motion, which generally not applied to the orthodontics. So when we study orthodontics, we are studying friction related to the orthodontics. We are talking about static friction and not kinetic frictions. Now, when we study friction, we need to address something we call it the contact area. So if you have this subject sliding against this surface, you will be imagining that if we increase the surface area of this object, then we will have a more contact between this object and this surface. When we have a more contact between this object and this surface, we're going to have more friction, which kind of makes sense. If I have a smaller object, I will have a smaller contact and then a smaller resistance and then a smaller friction or lower friction value. However, this is not the case, because if you take this object and study it under the microscope, it will appear something like that. Which basically, if we have in this here the beam, and then you have from this two, like this is the object, for example, this is the wire and this is the bracket, we will look at it in the endoscopic microscope. It's not a flat surface. It's made of like a spikes, like a mountains here, like a spikes going up and down. These spikes, we call them asperties, all right? So the contact between the object is really not this contact, it's only the smaller one of these asperties. So when you slide two objects against each other, now the sliding does not depend in the total surface area, it depends on these asperties. So basically, the friction is independent about the area of contact. We don't care about this area, we care about these ones. Now, if you do pressure about these asperties, that will result in what we call it a plastic deformation. They will bend. And then that will result, so if you imagine if you are applying load from the top, that will result in squeezing or like pressuring or doing plastic deformation of these asperties. That will increase the surface area, and that will consider as increase in the frictional resistance. So the true contact area is to be considerable extent determined by the applied load and is directly proportionate to it. Which means if you apply more load to these asperties, they will be squeezed more. So we're going to have more contact between these two asperties. We're going to have more retention. So we don't care about this contact area. We do care about the load that might result in the plastic deformation of this object that will result in a more contact area. Now, the harder the material, it will be having less plastic deformation and so less friction. So for two objects now to slide against each other, what we need to do is to apply a force enough to break the shear, like what we call it the shear strength, or to break the forces between these two objects to allow them to slide. Now, this kind of forces, it has to be stronger than what we call it the shear strength, which is how much these two objects are binding together. So what is exactly the shear strength? We need to understand that one. These are like the summary guide for you to study. To understand the shear strength, imagine if you are holding a stack of books like this with your two hands and you're carrying them. You are pushing here and here, but you are not holding the book from in the middle. But you can take them and move them around. So why this textbook is not coming down? Because simply there is a friction between these two that is preventing this textbook from sliding. You are compressing these textbooks against each other. So here comes the definition of the shear strength of the material, and it's defined as its ability to resist forces that cause the material internal structure to slide against each other. So this textbook now is trying to slide downward because of the gravity. It's a big textbook, all right? So, but then you are holding it with your hand, and the shear strength is still higher than the force that is exerted in this textbook. If you do the same experiment, but instead of having a light textbook, you have a very heavy textbook. And because of the gravity, the force that we will have from this textbook is higher than the shear strength, so the textbook will fall down, and that we'll call it sliding against each other because it overcomes the shear strength of the material. So for two objects to slide against each other, the force applied on this object should be greater than the shear strength. So when a force is applied to an object, all right, that will slide against each other. So that what's going to happen, the shear strength, the shearing start to happen between these two objects. Okay, as like they are trying to slide against each other, so the shearing start to happen in this object. Now, if this object is having a huge, it is flexible and it has a plastic deformation, this area will become bigger and will have more shear resistance. While if this material is hard and it is not going to have a plastic deformation, the shear strength will be lower and it will slide easier. So that's why rigid material who have less modulus of elasticity, they will slide better than the material who are flexible and can go under plastic deformation. There is a concept called stick slip phenomenon, in which what's going to happen that you apply enough force to shear the junction, and then a jumping happen, and then the surfaces stick again until another force is again built up to break them. So it would be like stick slip. All right, that's how the teeth kind of move. So to summarize it, the coefficient of friction will depend or proportionate to the shear strength of the subject. The more shear strength we have here, the more friction we have. So the more resistance for sliding we have. As I said, that this shear strength is depending on the rigidity of the material. The more rigid the material, the less shear strength, the less plastic deformation we have, which means that it will be less friction and less resistance for sliding. So that means that the coefficient of friction is inversely related to the yield strength of the material. Now, friction will be affected by the interlocking between the surface irregularities. I'm not talking about, these asperities, if they become like it jump and then become overlapping, so that will kind of increase the friction. And that would be more important of the asperities that are long and pointed, if they are long and large and pointed, so that will happen to have an interlocking for the and prevent sliding. And the last one, it affects if we have two surfaces and one of them is harder. The one surface we're going to cause something, we call it like a blowing to the surface of the softer object, causing, for example, like a hole in it or like a depression that will prevent the sliding of the arch wire. So the coefficient of friction, it depends on the shear strength, depends on the yield strength of the object. It depends on the interlocking that we are having, and it could be affected by the blowing effect, which is if a harder material causing abrasion to the softer material. Now we talked that friction is affected, as we said, by these factors, but also it could be affected by the nature and the surface of the sliding surfaces. For example, if we have a night-eye wire and a beta titanium wire, if we study them, then we can see that the night-eye wire having a higher friction compared to the beta titanium wire. However, the resistance for sliding, not friction, the resistance for sliding for the beta titanium wire is higher than that for the nickel titanium wire. And why is that? It's because of something we call it the surface activity. Now, nickel titanium have 50% titanium, while beta titanium have 80% titanium. So we have more titanium in the beta titanium alloy compared to the nickel titanium. That higher nickel composition, it will help the wire to cold weld itself into the bracket, which makes the sliding more difficult. So as we mentioned, that friction is important, but then again the surface activity, the chemical surface activity also has a role to play. So far we discussed friction, about the effect and resistance of a sliding, and then we're going to talk about something we call it binding. So what do we mean by binding? Now when you apply the force to the arch wire, what's going to happen? The tooth first will slide and then it will tip. The crown will move more than the root, and we're going to have, and because the wire, the size of the wire is smaller than the size of the bracket, we're going to have like a play, and then we're going to have a contact on this angle and another contact on this angle. Now this contact, we call it, that might result in a binding between the bracket and the arch wire. So what's going to happen, this bracket is hard and it's going to cause notching to the arch wire, as we can see. This is an arch wire, this is a scan electron microscope for this one, so you can see here what we call it notching. So what's going to happen now, the tooth will tip as we mentioned here, and then we're going to have a contact in this corner and another contact in this corner. Now because this one is hard or this one is harder, so what's going to happen, it's going to cause this depression that we are seeing here. So the bracket will stick in this depression and the tooth will not move. We call this binding. And then what's going to happen is that the patient is eating, talking, the tooth will jump outside from this binding and start moving again, tipping, causing notching to the arch wire, binding again, then you have to release the binding and start the movement again. So that's kind of thing that will kind of slow down the tooth movement, which is the binding between the arch wire. So once we have like the tip, we will have a contact between the corner of the bracket and the arch wire, which results in a notching. This notching later will result in a binding between the arch wire and the bracket. And that's how now we have the resistance for sliding. An example for that when we have a ceramic bracket. Now we all know that we have these ceramic brackets and we like it because the patients like the aesthetic appearance. Now we have two types of these ceramic brackets. We have polycrystalline and we have monocrystalline ceramic brackets. Now, when the polycrystalline came up first, they were a rough surface and they have a higher friction. Then monocrystalline came in and they have less kind of friction compared to the monocrystalline. But still the resistance for sliding is high. But why is that? Because the ceramic bracket is very hard. They are very hard brackets. So what's going to happen, they first going to tip, as we agreed, that the tooth crown will move first, and then the corner of the bracket will attach to the corner to the wire, causing notching to the arch wire and causing more binding. And this more binding will kind of slow down the tooth movement. So if you're going to think about it, that the ceramic bracket will be slower in a tooth movement, that could be possible, but that's not because of the higher friction. It's because the ceramic bracket is harder and causing more binding between the bracket and the arch wire. So if you're going to study it here and see what's going to happen when we start the tooth movement, when you apply the force, there will be a contact between the wire and the bracket. So for this tooth to move, it has to overcome the resistance of sliding, which is at this moment depending on the friction between the arch wire and the bracket. So we're going to have a friction between, because at this point we don't have any tipping yet of the tooth. So we don't have a contact angle between the wire and the bracket. So there's no binding at the early stage. So later on, because the crown will move quicker than the root, we're going to have tipping of the crown. So we're going to have this contact. And now it starts building up the binding as a resistance for sliding. So now the resistance of sliding will be equal to the friction plus the resistance, the binding that happened between the wire and the bracket. However, if you're going to consider which one is more important in these cases, is it binding or the friction? I'm going to say binding can cause more resistance to the tooth movement compared to the friction. I'm not saying that friction is not going to it's not slowing down the tooth movement. No, I'm saying is the effect is mainly due to binding. It's more than the effect of the function of the friction. So most of the resistance for the sliding will come from then binding and the notching that we are having. For that reason, when you think about it, okay, why are we not using a smaller bracket compared to the large bracket that we are using? If you're gonna have a smaller bracket, for example, you're gonna have a less surface area, so you have more sliding. And the answer is incorrect, because we agreed that friction is not related to the contact area of the wire because of the asperties. The second thing, when you have a narrower bracket, the tooth will tip more. So we're going to have here something we call it the contact angle. So what is the contact angle? When you start moving the tooth will tip first, and then until the two corners of the bracket hit the rigid wire and they stop. How much tilting happened before stopping is called the contact angle. The more contact angle we have, as you can see here, the more binding we have, because it will bind more to the wire and the bracket. And as we mentioned, that the effect, if you compare the effect of friction and binding on the resistance of sliding, we said that binding is more important. It has more input compared to the friction. So you are increasing when you use a smaller bracket, you're increasing the contact angle, which will result in increase in the binding between the wire and the bracket. So again, if we have to move the tooth, we have to overcome these forces that we need to overcome the forces has overcome the contact between the wire and the bracket, and also to create a bond remodeling. So to summarize it, when the wire has to slide, the bracket has to slide on the bracket. For it to move, it has to overcome what we call it the resistance of sliding. That depends on three factors: friction, binding, and notching. And as we mentioned, friction, it depends on the force necessary to do the shearing, the shear strength of the object. So the force to overcome this asperties to start moving. The second one is the resistance for the unlocking between these two, and the third one, the blowing component of the force. So basically, when you're having a harder object, as we said, that causing like depressions in the arch wire. So the total now resistance of sliding, to summarize it, it depends on friction, binding, and notching, with binding being the more important one, as it counts more for the resistance of sliding. So the conclusion will be, for a very early alignment of tooth movement, resistance to sliding is a combination of friction and binding. But almost immediately, the frictional component becomes so low that it is negligible, and the resistance to the sliding is mainly due to the elastic binding. Now we are done with the resistance of sliding and talk about the force delivery system, which basically, if you want to apply force to distalize the teeth, how are you going to do that? The first one is called the coil spring. Now, the coil spring, we have two types, either a closed one or open one. So the closed one, you simply stretch them, and then you can go back to their original position, moving the teeth with them. Or the open one, in which you squeeze them, and that will open up, so they will push the teeth apart, away from each other. So for that one, for example, that is used for a space closure, while this one for used to open space. Now the force that is delivered by this coil spring, it depends on the number one, diameter of the wire. So the more the diameter of the wire, the more forces that we get, and usually it's to the power 3, which means that if you double the diameter, the force will be tripled. 3 times 2, it will be 8 times. So it's 2 multiplied by 2 multiplied by 2. Then the degree of stretching, how much we stretch this coil spring, is how much force we get. The more we stretch, the more force we get. The lumen size of the wire, which is the lumen inside this one, so the one is here. The bigger the lumen size, the less, the bigger the lumen force, the lumen size, the less force we are applying. So if you increase the lumen size, you will reduce the amount of the force that you are applying. And the last thing is the length of the spring. Again, if you increase the length of the spring, you will increase you will reduce the amount of the force that you're applying. And that summarizes what I have just said. Then the second type of the force delivery system is the power chain. Now the power chain are used from polyurethane, similar as to the modules, and we stretch it, and that will close the space. Now we have different sizes of the power chain depending on the size joining these rings, the O-rings. So the bigger the size between the rings, that means this can be used for huge spaces. While if this distance is smaller, okay, that means it will close the smallest spaces that is there. So the bigger the space, the bigger the gap should be between these teeth. As a rule of thumb, and this is a rule, it's not always, we use these spaced one when we want to maintain the space. So we close all the spaces, that's recommended by MBT, and you don't want these spaces to open again, so you can use the spaced one. Or in cases in which you have severe spacing and the distance between the teeth are too big, you need to do a spaced power chain. The second type of the power chain, as you can see here, is the one that we call it a short power chain. So basically this distance is short. This one is called open one, while this one is called continuous because there's no kind of neck between the two modules. Now this one is used in the upper arch, while this one is used in the lower arch, and that's because the lower arch, the mesodistal width of the teeth is small, so you don't need to do a lot of stretching of the power chain, so you need a smaller one to bring these teeth together. Now Which one is better? Is it the night tie, closing coil, or the power chain? Now, the main disadvantage of the power chain is the force decay. That it's decayed by 50 to 71% after only 21 days. However, a coil spring will decay only by 8 to 17% in the same period. So the force decay is higher when it's come to the power chain, and for that reason, some clinicians, what they do, they place the power chain and then see the patient after, instead of 6 weeks, 4 weeks, because he has to make sure to replace this power chain. Last thing in this lecture today is the elastomeric rubber band, which is if you're going to use class 2 elastics or class 3 elastics. As you know, in the clinic we have multiple sizes of the elastics. You have 1/8, 3/16, 1/4, 5/16, 3/8, and that's measuring the lumen inside the elastics. And then the material of the elastics and the thickness of the elastics is different, so that make them generate different amount of force, which is light, medium, and heavy. And as you can see, the amount of the force is measured in O's. So you have like 3.5 O's. So if I use, for example, 5/16, I'm gonna use medium, I'm gonna get 3/3.5 O's. Now to get this 3.5 O's, you need to use the elastics in a way that this elastics will be stretched 3 times its original size to get you the force that is written here. The O's, it's worth mentioning that the O's is about 28 grams. So, how to use the elastics? Let's assume that you have a class 2 patient and you need to use class 2 elastics for this patient. Now, we know that to achieve bodily movement, we need 150 grams to achieve this bodily movement. However, when you are doing this bodily movement, you need to move the whole lower segment, which means that you need more than 150 grams. All right, so you need more force on that side. And here, medium, here you're gonna consider which type of the elastics, which type of the rubber elastics are you gonna use. So if you go to the medium one, which has 3.5 O's, which means it's gonna give you around 100 grams of force. Is that enough? The answer is no, because you need to move the whole segment. So instead here, I have to go to a heavier one in order to achieve this movement, because I need more force to move the teeth. So I can either use 2 elastics on the same side, or using a heavy elastics on that area to move the whole buccal segment, because you need to apply the necessary amount of force. So to summarize it, if you need to do use class 2 elastics, for example, or to use elastics, you need to decide how much force do you need, and then you multiply the O's by 28. That will give you the amount in a gram, so you can understand, okay, this is the amount of the force I needed, and then you measure the elastics. Stretching the elastics 3 times its original length will give you the amount of the force that is needed. That's all for today. Thank you very much.